Hi there, I'm Nico. Did you know about the word pneumono-ultramicroscopic silicovolcanoconiosis? It was 45 letters, but I'm not gonna talk about how long the word is. I'm gonna talk about why it is a disease and its causes. Pneumono-ultramicroscopic silicovolcanoconiosis is a respiratory disease caused from inhaling silica dust from volcanic debris. It is also known to be synonymous with pneumoconiosis and is also otherwise known as the black lung. Black lung is an occupational disease, meaning that you would only encounter it on mining or working places. It is classified as a pulmonary parenchymal fibrotic illness, meaning that it damages your respiratory organs along with organs confined with your kidney. Black lung is caught airborne by inhaling silica dust from workplaces with high dust content. Its hallmark symptoms include shortness of breath, intense coughing, and cyanosis, blue skin. The target age group often includes middle-aged blue-collar workers who work in industries where silica dust is prevalent. However, in the Philippine setting, it can reach in all ages as long as you live near an active volcano. After all, we're in the Pacific Ring of Fire. Fun fact, did you know that the last blast of Mount Bulasan in Sorsogon has been suspected by volcanologists to cause silicosis? Still, that death rate is regarded as extremely low because the condition requires lengthy and extensive exposure to very small silica dust particles. There is no specific cure for the illness. However, home pain alleviating methods include air purifiers and to avoid other airborne contaminants. In medication, bronchodilators or corticosteroids may help alleviate your symptoms.
But pneumono-ultramicroscopic silicovolcanoconiosis is rare. Why don't we talk about something relevant like pertussis or whooping cough? Pertussis! Do you know that the common name of pertussis is whooping cough and the scientific name is Bordetella pertussis? The cause of the pertussis infection is a bacterium called Bordetella pertussis, and the various factors can spread within the communities. The mode of transmission is through respiratory droplets. Droplets from coughs or sneezes release Bordetella pertussis into the air, which can be inhaled by others and spread through direct contact and with affected people. The symptoms had several stages. First is the catarrhal stages include mild, low-grade fever, sneezing, and a mild cough. Second is the paroxysmal stage, worsens and becomes more severe with sudden uncontrollable coughing fits. The third is the convalescent stage. It gradually decreases but many persist for weeks or months with fatigue, lingering cough, and respiratory symptoms. Recovery can be prolonged. Pertussis can be treated with rest, hydration, honey, and humidifiers, while medical treatments may include antibiotics, cough suppressants, bronchodilators, and hospitalization for severe cases. Pertussis is classified as an obstructive pulmonary disease.
Kanina, sinamay ako ni Birdie Jean. Sabi niya may pertussis daw ako. Kuwan pa siya eh.
Bronchitis. The common name is bronchitis, and the scientific name is Candida albicans and Aspergillus fumigatus. So, the classification of the bronchitis is a persistent inflammatory bronchial illness that causes the bronchial lumen to irreversibly dilate is called bronchiectasis. The bacterial illness and inflammation that cause bronchiectasis harm the mucociliary system, which permits the growth of bacteria, mycobacteria, and fungus in the airways. The mode of transmission is when fungal spores enter the respiratory system through inhalation. They can colonize and infect people who have compromised mucociliary clearance or who are immunosuppressed. Signs and symptoms: a persistent cough and excretion associated with bacterial infections, isolated yeast, and filamentous fungus or molds. The pathogenic function, or which is still unknown, are symptoms of bronchiectasis. Target age group and attack rate. Among the elderly or those with impaired immune systems, lung fungal infections are common and can lead to chronic illness. Home remedy and medical treatment. While allergic bronchopneumonia is treated with oral corticosteroids, lung fungal tumors are surgically removed. Treatment for pulmonary fungal infiltration depends on the patient's health and the conditions of the hospital. Warm drinks and honey are two common home treatments for respiratory infections and coughing. Restrictive or obstructive pulmonary disease. An irreversible dilatation of the bronchial lumen resulting in airflow blockage is the hallmark of bronchiectasis, an obstructive lung illness.
Hello, I'm Sandosi, and the next topic we're talking about is bronchiectasis.
Bronchiectasis is also known as non-cystic fibrosis or non-CF bronchiectasis. The ones that are most commonly isolated in bronchiectasis patients are Candida albicans and Aspergillus spp. Of these, the various species of Aspergillus spp have the greatest pathogenic potential. Common causes: childhood infections. Around a third of cases of bronchiectasis in adults are associated with a severe lung infection in childhood, such as immunodeficiency, allergic bronchopulmonary aspergillosis or ABPA, aspiration, cystic fibrosis, cilia abnormalities, connective tissue diseases. Mode of transfer. The cause of bronchiectasis is genetic and congenital without an infection. It will not be contagious. If the cause is a virus, the disease can be transmitted from an infected person to a healthy person through the respiratory tract. The home remedies. Bronchiectasis cannot be cured, but there are treatment options which can be done to manage the condition, and the main aim is to keep the infection and bronchial section under control. The common methods to treat bronchiectasis are airway cleaning methods, antibiotics, oxygen therapy, and sociotherapy of the chest. Is bronchiectasis restrictive or obstructive pulmonary disease? Bronchiectasis belongs to the family of chronic obstructive lung diseases.
Next we have cystic fibrosis. Hi, I'm Harriet. Let's dive into the world of cystic fibrosis and find a way to love through the mucus. Cystic fibrosis, also known as CF, is a genetic disease caused by the mutation in CFTR, or cystic fibrosis that's membrane conductance circulatory chain. The disease is identified as an obstructive pulmonary disease. The scientific name of the fungus causal infection is Aspergillus subcutaneous. CF can be caused by the various infections such as common symptoms of CF are the disease primarily affects children, with 75% of people are being diagnosed at the age of 2. However, people that are 18 years old or older can also be affected.